Bismillahirrahmanirrahim. In the name of Allah, the most beneficent, the most merciful. My name is Dr. Muhammad Yasir Waqas, and today I am going to present therapeutic efficacy of Acacia Nilotica against osteoarthritis in rats. Acacia nilotica is locally named as babul. The length of that plant is 5 to 20 meter tall, while the bark of that plant is brown to black in color, which can be used as a medicine to treat several kind of diseases. The use of medicinal plants has a long history because in previous few decades these plants are widely used to treat different disorders, so that is not a new science or a new theory. Industrialization and modern innovation in research and techniques introduce a new way to use of ethnomedicine to treat some kind of chronic disorders in current years. The problem statement is that the osteoarthritis is a chronic disease which is associated with the inflammation, bone reshaping, cartilage degeneration, and furtherly it lead to the stiffness of the joint. And in chronic form, you can see also the immobility of joint, mental disorder, and if not treated well, it can lead to the death of the patient. Uh, the use of medicinal plant, why we use it? Because the conventional treatment protocol in the case of osteoarthritis, because you can't use certain drugs for longer time period, especially the anti-inflammatory drugs. They have serious consequences on the digestive tract. So for that reason, we wanna develop a drug that has a minimum side effect and which has a better recovery rate. These kind of drugs either independently or with the synergism effect with the conventional treatment protocol, we wanna validate that idea. So, the traditional use of these ethnomedicine has already been reported, which are used against several diseases. So, against the osteoarthritis, there is no validation of that scientific question. So we wanna check to validate the research. For that purpose, the aim and objective of current study is to either check the efficacy of that plant against inflammation as a point number one. The point number two is if that is it has the capability of anti inflammatory properties, so we can treat that plant and we can have direct implication for the treatment against osteoarthritis. And the third part is that we want to check the synergism effect of that plant together with the conventional treatment protocol to reverse the osteoarthritis. So methodology, we have we have taken the bark of the plant, then we have prepared a methanolic extract of that plant, and we want to check the physiochemical analysis of against the osteoarthritis, and we wanna validate the anti-inflammatory activities using rabbit as animal model. For that purpose, we have sorted four groups. Number one, the osteoarthritis was induced in that animals with the injection of paraform aldehyde directly into the joint cavity, and furtherly treated with the methanolic extract of the plant at the rate of 500 mg per kg for 21 days. While the group 2 has administered with the drug of choice, which is linzolide at 70 mg per kg for 21 days. Again, the osteoarthritis was induced with the help of formaldehyde. The third group was a synergistic group in which both the plant and the conventional treatment was taken in consideration. The group fourth was controlled, to compare all the progress of all the three groups. The parameters were taken as a physical like pass swelling, body weight, hematological parameters with the inclusion of white blood cells count and ESR, and the histopathology and radiology was done to check the progress or efficacy of that plant against each day. So the results showed that the group 1, which was our plant group, it showed a better recovery rate. At day 1, you can see at the arrow indicate at the paw joint, you can see easily the swelling is there. And after 14 days, much compromised and 40 to 50% less as compared to day 1. And the third category, it got reversed at day 21. The group 2 showed a same pattern in which drug of choice was inducted in that group, where at day 1 you can see the swelling at paw joint, and at day 21 the swelling was reversed with that. So surprisingly, when we go for the co-administration of the drug together with the plant, a better recovery rate was noticed, like in the 14 days. We don't need a 21 days overall. At day 14, the better recovery rate was noticed, and it lead to the early prognosis and with the minimum side effects. So the same pattern was seen in the ultra sections of the histopathology, where you can see at day 1 there are inflammatory infiltration of the immunity cells. At day 14, the inflammation and the infiltration of immunity cells was lesser been seen, while at day 21 it was lead to the prognosis and the recovery rate. Though the group 2 indicate the same pattern just like group 1, in which the inflammation is there at day 1. At 14, you can see infiltration, degeneration of immunity cells, and at day 21, it get normalized. Surprisingly, again, the group 3 co-synergism with the drug and the drug of choice with the plant, a better recovery rate was noticed, and the organization of the muscles and the matrix was okay at day 14. So it means that 1 week before it lead to the recovery of osteoarthritis. When we see the trend of serum inflammatory biomarkers like CRP and ESR, the CRP of the group 3, which was the synergism group, it showed a better recovery rate in reversing the inflammatory markers in the case of both the CRP and ESR. While again, past swelling was batterly recovered in the group 3 when we used co-injection of the methanolic extract with the linezolid. So the conclusion of current study is that Acacia Nilotica is evenly distributed. You can find everywhere in Pakistan. It is a cheap, economical, and easy accessible to everyone. So it can be used in all certain kind of and inflammatory diseases like osteoarthritis is a top trend nowadays, because elderly people are suffering day by day, and it can be treated with that plant, and it showed a better recovery if you use as a synergism effect with the drug of choice with the minimum side effects. Thank you so much.